Hi, I'm Cassandra Frederic. I'm the Executive Director of the Drug Policy Alliance. Our mission is to end the war on drugs, and we are leading a growing national movement to eliminate criminal penalties for drug possession and reinvest drug enforcement resources into treatment, harm reduction, and other addiction services. Last November, DPA and our local allies made history when Oregon became the first state in the nation to decriminalize drug possession and expand access to health and social services. I'm honored to have the opportunity today to share our vision for shifting to a health approach to drugs and building a world where our drug policies are grounded in science, compassion, health, and human rights. Let's get started. This month is the 50th anniversary of Richard Nixon declaring the war on drugs, a war that was never actually about the safety and health of our communities. It was about criminalizing, arresting, and incarcerating people fighting for racial justice and against the Vietnam War. And over the past 50 years, the drug war has failed our communities and caused immeasurable damage, all disproportionately impacting Black, Latinx, and Indigenous and people of color. The war on drugs is a war on people. And if we hope to improve the health of our loved ones, families, and communities, we must end it. The foundation of the drug war is criminalization. One person in the United States is arrested every 23 seconds for drug possession. It is by far the most arrested offense in the United States. And the criminalization of drug possession is the root of countless harms. Our country has spent billions of dollars punishing people for addiction and drug use, when they could have instead offered to help people who need it and want it. The decision has led to devastating consequences to individuals and our community's health. The starkest example is the overdose crisis. Overdose is now the leading cause of accidental death in the United States, with more than 90,000 deaths in 2020 alone. Evidence shows that criminalizing and punishing people for addiction does nothing to help them. In fact, it does the opposite. It exacerbates the root causes of problematic drug use and compounds the harms. In the first 2 weeks after release from jail or prison, people are 40 times more likely than the general public to die of an overdose. Mass criminalization is a public health crisis that has impacted generations. The criminalization of drug possession allows law enforcement to harass people, to prosecute and incarcerate and deport people, and even to justify killing people. And those people are disproportionately Black, Indigenous, and Latinx. And we see this every single day when we look at the deaths and the killings of folks like George Floyd, Marvin Scott III, people like Andrew Brown in Elizabeth City, all of which they have used drugs as either a pretext for law enforcement involvement or justification for the violence that occurred after. Because of targeted policing of Black people who use drugs at the same rate as white people, or even less, they are 3 times more likely to be arrested for drug possession. I think it's really important here for us to recognize that oftentimes when we hear these facts around what group of people has been more likely to be arrested or more likely to be harmed, that those things aren't happening in a vacuum. They're happening because of intentional policy choices. Intentional targeting creates the circumstances for Black people, or people of color, to be arrested at higher rates. These are not because these people are using them, right? This is because of targeted policy choices. And this is super critical because if people are making intentional policy choices, then we can intentionally take those choices apart. Today, there are 450,000 people who will spend the night behind bars because of a top charge related to drugs. And there are tens of thousands more who are locked up for drug-related violations of parole or probation. And more than 17,000 people were deported in 2019 for drug charges. Mass incarceration is a public health crisis. Evidence shows that incarceration results in higher rates of chronic health problems, substance use disorder, and mental illness. Drug laws are a major driver of criminal records in the United States. And those records saddle people with lifelong burdens and barriers, trapping them and their loved ones in a cycle of poverty, injustice, and negative health outcomes. The ripple effects harm our communities for generations. And this public policy disaster costs us over $47 billion a year. Imagine with this kind of investment in the public health infrastructure. But instead, we use it to incarcerate, to criminalize, to stigmatize, to punish, to surveil people who are struggling. The war on drugs is a war on people, and it's long past time for us to end it. And we think that we need to end it, we know the way for us to end it is by eliminating criminal penalties for drug possession, also known as decriminalizing all drugs, divesting from policing and punishment, and investing in health and community support systems. All of this are things that everyone here today pretty much know already. As our country reckons with racism, police violence, and the overdose crisis, drug decriminalization has the potential to fundamentally shift and transform our approach to public safety, policing, and community health. By decriminalizing all drugs, we can free up money spent on policing to address the root causes of problematic drug use and poverty, including healthcare, education, and housing access. A health approach to drugs would save countless lives. Right now, our systems of care are distorted by draconian laws and decades of stigmatization, leading to a lack of services. But our past need not define our future. It's possible to build alternatives that promote health and well-being, including harm reduction, evidence-based drug treatment, mental health care, and housing. What this means is that if we decriminalize drugs, we would have the freedom and resources to address root causes of problematic drug use and treat addiction as a health issue. It means millions of people will never enter the criminal justice system. It's a hopeful future, one with the potential to break cycles of intergenerational poverty, injustice, and negative health outcomes. If our goal is actually to address health problems rooted in poverty, trauma, mental illness, we must dismantle the systems that exacerbate those harms. We must dismantle criminalization. This is imperative. As the nation is having conversations around policing and looking at conversations around defunding, the issues that people are very clear on that they don't want law enforcement to engage in are issues of housing and homelessness, issues of mental health, and issues of addiction and substance use. So through decriminalization, through health alternatives to drug use, we can create platforms for the broader social justice movement to imagine and create alternative responses that do not rely on the pillars of criminalization, surveillance, and punishment. This is truly an opportune moment for folks to reinvest resources, but also to imagine and build new ways of working and navigating complex human behavior. On November 3rd, 2020, DPA and our political arm, Drug Policy Action, did just that. Oregonians voted overwhelmingly to pass Measure 110, the first in the nation drug decriminalization and treatment initiative. It is the most significant drug policy reform since the disastrous modern-day war on drugs began 50 years ago. DPA has extensive experience with ballot initiative campaigns, having been involved in dozens over the years. We know all too well that elected officials are timid on drug policy reform, while the public is far ahead of them and on our side. So once again, we leverage the tools of direct democracy to make significant change. And the changes that Measure 110 made are significant. Its overarching goal is to dismantle the system of punishment and build a compassionate, supportive alternative. Measure 110 does three things. First, it eliminates criminal penalties for drug possession. Second, it increases access to health and harm reduction services, including housing, and establishes treatment centers. Third, it funded with upward of $100 million a year in marijuana tax revenue, as well as reinvested criminal legal system savings estimated at $60 million a year. I want to say that again. It funded with upward of $100 million a year of marijuana tax revenue, as well as reinvested criminal legal savings estimated at $60 million a year. This is brand new money that we're using to fund health initiatives. The Oregon Criminal Justice Commission estimates that Measure 110 will reduce drug possession arrests by 91%, and racial disparities in drug arrests by 95%, and drug convictions for Black and Indigenous people by 94%. This is seismic in impact. Measure 110 passed overwhelmingly, but it was a long road to get there. In Oregon, we began well over 15 years ago when the Drug Policy Alliance built partnerships with local organizations in the state working on health and justice issues. We provided support to local groups like Partnership for Safety and Justice, and we also led and supported legislative and ballot initiative campaigns in the state, from marijuana legalization in 2014 to eliminating felonies for drug possession in 2017. Fueled by those successes and with strong partners by our side, in 2018, we began to explore what ultimately became a historic campaign. To win a ballot initiative campaign, the voters either have to already be with you or have to be able to persuade them to join you. So starting in August 2018, we began a major public opinion research project to find out where we stood. We found that people in Oregon viewed the war on drugs as a failure that had negatively impacted the economy, society, and their own families. 71% of voters viewed problematic drug use as a very serious problem in the state. And by a 2-to-1 margin, they thought Oregon's marijuana legalization initiative that passed in 2014 was working well. So people saw a problem that needed to be fixed. They recognized that the current policy regime wasn't working, and they believed that changes to drug laws could be beneficial. When voters understood that we were not only eliminating criminal penalties, but also expanding access to health and social services, we saw substantial levels of public support. Oregonians of across the political spectrum were overwhelmingly enthusiastic about a proposal that provided the health approach to drugs that they believed was sorely missing. The key takeaway is that people are willing to embrace a bold approach if the alternative is tangible and addresses the needs of their families and communities. With this research and our values as our guide, we crafted a policy model and messaging frame that garnered a very strong level of public support. But good policy is meaningless without people power. Over time, we built a powerful and diverse coalition of over 130 organizations and prominent individuals, including social service and healthcare providers, the treatment and recovery community, unions, racial justice activists, and even some in law enforcement and other unlikely allies. We succeeded because of the passionate, dedicated community organizing efforts of groups like Unite Oregon, the state's leading racial justice organization. They served as a key partner throughout the campaign. With increased funding from our national allies, Unite had the resources necessary to expand their capacity to organize and build power in their communities in support of a health approach to drugs. We also had a message that resonated with voters. We ran television and digital ads across the state, not just in cities, but also in rural areas. We featured people who would be most impacted by Measure 110, people who were formerly incarcerated, those in recovery, those who had lost loved ones to overdose. We also secured key endorsements from state news outlets, the most significant of which was the Oregonian, the state's politically moderate paper of record. All of this was possible because of our community of funders who were willing to join us in the dreaming big. We raised and spent more than $6 million on this campaign, including from some funders that are in the Grant Makers and Health Network. Our funders understood their investments had the potential to transform Oregon and provide an inspiration for states across the country. And on November 3rd, Measure 110 passed with a resounding 58.5% of the vote, a 17-point margin of victory, and a two points more than President Biden got in the state. We also won several rural counties that typically do not support progressive reforms. It was an astounding accomplishment, but we barely paused to celebrate. Our work in Oregon was not finished. We know that implementation of policy is critical. Early in the campaign, we began strategizing and working with local allies to ensure Measure 110 would be implemented as intended if we won. As soon as the votes were counted, our coalition pivoted full-time to implementation, including legislative and regulatory advocacy, grassroots mobilization, and communications, all with an emphasis on ensuring those most impacted by the drug war, Black, Latinx, Indigenous, and low-income people are involved in decision-making and prioritized for funding made available by Measure 110. In May, the state of Oregon dispersed the first $20 million in funding for expanded health services in the state. This is 5 months ahead of schedule, thanks to the robust implementation advocacy effort that DPA and our allies have led. The Attorney General also announced that she will invest all of the funds from the state's opioid settlement in the programs and services created and expanded by Measure 110. Implementation in Oregon is important to ensure Measure 110 delivers on its promise, but also because this effort is bigger than a single state. It's critical that the first state to decriminalize drugs succeeds. Oregon is leading the nation and inspiring advocates across the country to reimagine what's possible. And our public opinion research shows that Oregonians are not unique in their receptiveness to overhauling their drug laws. Over the past 6 years, we have conducted public opinion research on the concept of decriminalization nationally, and in California, Maine, New York, and Washington state. Across the board, voters view problematic drug use as a very serious issue, or even as a crisis. And across the political spectrum, voters agree that the war on drugs is a failure and that we need a new approach that centers health and well-being of individuals and communities. It's clear that Measure 110 is ripe for replication. At DPA, our big dream is to shift the health approach to drugs and eliminate criminal penalties for drug possession across the country. The Oregon model is evidence-based, it's scalable, and it's effective. Since Portugal enacted a similar drug decriminalization policy in 2001, the number of people voluntarily entering treatment has increased significantly, while overdose deaths and HIV infections among people who use drugs have plummeted, and rates of problematic and adolescent drug use have fallen. Incarceration for drug-related offenses also decreased. Now that Oregon has shown us what is possible, we are working to create a domino effect across states and jurisdictions, and ultimately to impact federal policy. Indeed, the dominoes have already begun to fall. Policymakers across the country are openly discussing scaling back the punitive drug laws. Bills to treat drug use as a public health issue rather than a criminal problem have emerged in Maine, Massachusetts, Vermont, New York, and Washington. And advocates from Massachusetts to Washington to Colorado to California are strategizing about legislation and ballot initiatives for 2022 or 2024. We're also preparing for the introduction of a bill in Congress. When we started building Oregon Measure 110 several years ago, we dreamed that victory there would set off a cascade of efforts across the country. Now that dream is our reality, and we're starting to dream bigger. By 2030, we envision at least 100 million people living in places where drug possession is fully decriminalized and drug enforcement resources are reinvested in health and social services. Some will say this is audacious, which is exactly what they said when we launched the Oregon campaign. But we owe each other audacity. It's what this moment demands. Last year, 1.35 million arrests were made for drug possession, and 90,000 people died of drug overdose. In the time we're spending at this year's Grant Makers in Health Conference, that translates to more than 15,000 arrests and nearly 1,000 deaths. It is our shared responsibility to do something. This is a rare moment. A moment when the crises of criminalization and overdose are colliding, when public opinion actually agrees with evidence-based policy, and the solution is clear, scalable, and transformative. There is a growing national movement to eliminate criminal penalties for drug possession and reinvest drug enforcement resources into treatment, harm reduction, and other addiction services. If enough people join us in believing and building, we can change the policies and transform our country's approach to drugs and drug use. Together, we can make this dream for health and justice a reality. If you're interested in learning more or getting involved, please contact me. My information is on this screen. I'm very accessible and really interested in hearing from you all. Thank you.